Hello guys, in this video we will discuss about Bell's palsy. Bell's palsy means the sudden temporary weakness or paralysis of the muscles of one side of the face due to dysfunctions of the seventh, that is facial nerve. It was termed by the Dr. Sir Charles Bell's. He also termed the nerve long thoracic nerve, which is also called Bell's nerve. Now before understanding, let's learn about the facial nerve. We know the facial nerve is the mixed type of nerve which has got sensory and motor supply. The motor supply, it supplies the muscles of facial expressions. The sensory supply, it supplies the tongue, entire two-thirds of the tongue, which gives us taste sensations. We know the facial nerve nucleus is located in the lower portion of the bones. It has got two parts, upper and lower part. The upper part is innervated by the corticonuclear fibers from the same side and from the opposite side. You can see here this is in pink color. But lower part of the facial nerve nucleus is only innervated by the opposite corticonuclear fibers. So while innervating, the upper part of the face is innervated by the upper fibers and lower part of the face is innervated by the lower fibers. Same goes in the both sides. For example, if the lesions occur in the infranuclear part of the facial nerve below the nucleus, then the upper part of the face got involved, also the lower part of the face got involved. But if the lesions occur in the upper part of the corticonuclear fibers, we can see here the lower part of the face is involved, but the upper part of the face can be spare because it is also innervated by the fibers from the same side. So in case of upper motor neuron lesions, the upper part of the face is spare, but in lower motor type of lesions, which is types of Bell's palsy, the whole face is involved. We can see here in this diagram as well. Now let's see the difference between upper motor neuron lesions and lower motor neuron lesions. The locations of lesions in the corticobulbar tract above the facial nucleus in the bones, and in case of lower motor neuron lesions, the facial nerve nucleus or peripheral nerves. The common cause is stroke, most commonly MCA territory, brain tumors, trauma, etc. In case of lower motor neuron lesions, it could be Bell's palsy, which we will discuss in this video, Ramsey-Hunt syndrome, GBS, trauma, ipsilateral whole face. Facial involvement, there is contralateral lower face only. In lower motor type of lesion, there is ipsilateral whole face. Forehead wrinkling, there is a preserved or spear. In case of lower motor, there is absence. Eye closures, normal, incomplete, which is also called Bell's phenomenon. Mouth deviations opposite to the side of lesions, there is also opposite side of lesions. Now let's see the flow chart. If we suspect there is Bell's palsy, means the patient comes with the weakness of the one side of the face, then we should do clinical examinations to rule out stroke, tumors or infections. If no other cause are found, then we confirm Bell's palsy. We can do CT head and CBC, RFT to rule out the infections. We should treat the patients by giving steroids, corticosteroids, which helps in reducing the inflammations. The usual dose is 60 to 80 mg per day. We should give for 7 days, then taper. If we suspect viral infections, then we can give antiviral like acyclovir 400 mg 5 times a day for 5 days. It should be started within 72 hours of the onset of the symptoms. We can give artificial tears for preventing the dryness of the eye due to exposure. We can do physiotherapy and facial exercise. Within 3 to 6 months, there can be complete recovery. Now let's see the examples. These were the patients that came to my hospital. I have taken their consents. Now, if we see here, there is deviations of mouth to the right side, drooping of the angle of mouth of the left side, loss of nasolabial furrow, and there is a loss of wrinklings as well. Same here, and she is not able to close the left eye. So this is the left sided Bell's palsy. And we have got another patients. There is deviations to the right side, loss of nasolabial furrow, unable to close the left eye, and this is also left sided Bell's palsy. Now see here, there is deviations of mouth to the left side, drooping of the angle of mouth of the right side, loss of wrinkles in the right side, and difficulty in closing the right eye. So it is right sided Bell's palsy. I had taken the consent before snapping their photo. Thank you.